Hello everyone, welcome to the Differential Podcast. I'm Dr. Assem Al Refaei, and I'm excited to help you navigate the complexities of medical exams. With a Step 2 CK score of 283, I have spent a lot of time refining strategies to make exam prep as efficient and effective as possible. And I'm here to share what I have learned. Today we're diving into a critical skill, how to tackle exam questions efficiently. Whether you are taking UWorld, NBME, CMS, your actual exam, questions can be long and full of details. However, with the right strategy, I think you can navigate them without losing valuable time and with a higher probability of choosing the correct answer. So, let's start with the tips. First of all, start by reading the last part of the question. This is where the actual question lies. Sometimes you might be reading a question that's very long, and eventually at the end they tell you that ultrasound showed hypertrophic pyloric stenosis. And then the question might be about a risk factor or the management. So you have wasted your time reading everything above the sentence, and they give you the diagnosis after it. So pay attention to the last part of the question. Resist the urge to start from the beginning. Reading backward allows you to focus on what matters and avoiding the unnecessary details. Definitely it's a skill that takes practice, but it's key to managing your time during the actual exam. Second thing, when you find yourself stuck between answer choices, here is my go-to strategy. Start with the imaging, labs, then physical examination. These are objective data that are hard to twist. It's unlike the history. In the history, they are going to throw at you multiple risk factors or clues that will point toward multiple answers. So it's not going to let you know which choice is the correct one. It will lead you to few choices. However, the objective data, the imaging, the labs, and the physicals are the ones that will tell you the answer. We are so programmed that once we find ourselves unsure of an answer, we will start rereading the question from the beginning. And this is only going to make you more clueless, and is going also to waste your time. So go back to the objective parts of the question and pay close attention. I remember one question in UWorld where it was that on abdominal examination, they palpated a mass. And the question was between uterine rupture and placental abruption. And just because it's a very long question and I started rereading from the beginning, I missed this detail. And palpating a mass here was actually the fetus in the abdomen, which happens with uterine rupture. So paying attention to the objective data in your second read of the question is the most important thing to do. Third tip is to watch out for buzzwords. And that's a skill you will develop with time. You will start to identify buzzwords that or patterns that mean something, and once you identify them, you will answer. So a postpartum lady with uterine tenderness. Once you find uterine tenderness, your eye will go to the vitals and see fever. That's endometriosis, and so on. So there's also buzzwords like on pathology. They found lamellated calcifications, and this will tell you that this is papillary thyroid cancer, for instance. So with time, you are going to start learning what are the buzzwords, and you will identify them. And once you identify them, there is no need to read all of the question. You can go on and answer safely and save your time for the other more difficult ones. Another important point, since we're talking about time, is to not get stuck. You are going to have questions where you don't know the answer. If you are torn between two answers, three answers, pick one and move on. Flag the question. Come back to it if you have time. You don't want to lose precious minutes debating one question when there are easier points to grab, where there are easier answers and questions to answer. Like sometimes, and I hear it from many people I tutor, that they will end up having 10 questions that they have to answer within 10 minutes or less because they spent 5 or 10 minutes on 2 or 3 questions, which is unfair. Okay? My last step is to look out for emergency or urgent scenarios. If you see a choice that's intubation or that's IV fluids, pay attention. Come back to the question. It's okay to skip parts of the question. It's never okay to skip an answer. You have to read all the choices. You might think in your mind, in, for instance, a hypertrophic pyloric stenosis case, what's the next step in management? That's pyloromyotomy, the surgery, the curative option. That's how we are programmed as students to answer. However, there will be another answer, maybe D or E, that is IV fluids. and this would correct the electrolyte imbalances and maybe the hemodynamic instability in this patient before he's taken to the OR. So if you have read all the choices, whenever you see IV fluids, whenever you see intubation, whenever you see oxygen, these things are urgent and more important. You follow the A, B, C, D, E. So whenever you see these three options, pay close attention, come back to the question, see if there is a true indication for intubation. Is he an asthma patient with a silent chest? Is he an asthma patient with respiratory acidosis? All of these are going to be signs telling you you have to intubate. So whenever you see intubation, come back to the question and look for the indication. It will not be the first thing that comes to your mind unless you are a really, really very informed individual with clinical experience. So, by focusing on these strategies, reading the last part of the question first, prioritizing objective data, spotting buzzwords, recognizing emergency scenarios, reading all the choices and not getting stuck on questions, moving on, you will be able to manage your time better and make more confident decisions during the exam. These are my advices that I have not actually knew before I took my exam or before I started my preparation, but rather learned about with time and also with tutoring many bright students. So stay tuned for more tips, and I'll see you in the next episode of the Differential Podcast.